All right, let's go here now. Young scientists from the Council for Scientific and Industrial Research, the CSIR, have called on their peers to be more careful when sharing information regarding COVID-19 on social media. Now, this is to combat the rise in fake news. As part of Youth Month celebrations, young researchers have shared their cybercrime research and the spread of misinformation during this pandemic. Kirimotsi Baruni, CSIR biometric researcher, showcased the organization's face biometric technology, which does not require an individual to be in contact with the biometric acquisition device to perform identity verification. Kiri Motsi joins me now live via Skype. Kiri, thanks indeed for your time this evening. It's good to see you. So this technology is quite significant, especially during a time like this of COVID-19. Tell us how this face biometric technology can curb the spread of infectious diseases.
Okay, thank you very much for inviting me. Face recognition is able to curb the spread of COVID-19 because it's contactless. When you use it, you don't really have to be in contact with the face recognition hardware. So unlike face recognition is used for identity authentication, so it can identify an individually safely without any possibility of an individual contracting the disease. Like, for instance, when you go to maybe for access control, they usually use fingerprint. Fingerprint is also used for access control, but with fingerprint you have to be in contact with the hardware, which is the scanner. And COVID-19 can be contacted by touching objects which are infected. So during this era, face recognition is it's one type of biometric technology that can be used safely. Thank you.
Identification methodology would use then your eyes, your mouth, jaw and nose features, I understand, to identify any individual. Is that correct?
Yes, there are other algorithms, face recognition algorithms, which uses the face, the eyebrows, the mouth and the jaw. But the one that we implemented only uses 5 points. The first point is the one on the left eye and the other one on the left eye, so which is 4, and the other one is the one in the nose. So it only uses the nose and the eye regions.
How significant is this, especially in places like, hospitals, banks that are open now, where there is concern for the spread of COVID-19?
Hello? Can you come again?
All right, Kitty, I'm asking, so how significant is this, especially in places like hospitals and banks where there is concern for the spread of COVID-19?
Okay. It's very significant in those places because it's a public places. It's everybody who comes there. So you wouldn't know who used the system and whether the system is okay to be used by another person.
Yeah.
So face recognition is very significant because, like I said, you don't really have to be in contact with the camera.
So with this technology now, are you approaching banks, hospital, other public institutions to use this technology? Because clearly it would be a great method to use. I know going to the mall, going to various places, you no longer have to use your fingerprint in order to gain access to some of these public places. So are you approaching some of these institutions to get them to use this?
Right now we are at a process whereby we want to make our face recognition technology be operational at the CSIR.
Okay.
Before we take it to other companies, and also improve it so that it can also recognize people when they are wearing masks.
Oh, that sounds absolutely fantastic. Thank you very much indeed. I think much needed during this time as we try to curb the spread of the coronavirus. Kirimoti Baruni, who is a CSIR biometric researcher, talking to us about a new technology there where, researchers showcasing a face biometric technology which does not require an individual to basically be in contact with that biometric device in order for it to recognize them.